Hi everyone, I'm Claire Smith and I'm the clinical lead for CCICP's Community Bladder and Bowel Service. This short video is to support you as patients with regards to your new containment products, pads, which are now going to be delivered by NHS supply chain, and the company that makes the products are called Tenor. So here's some top tips to keep your bladder and your bowel as healthy as possible. Fluid intake. It's really important to have a good fluid intake to keep yourself hydrated. Our body contains 60% water, and to keep our bodies healthy, we need to make sure that we're drinking up to 8 glasses of water per day. Fluid helps to remove waste products from our body, helps to regulate our temperature, and regulates our blood pressure. It also helps us to pass our waste products down our digestive tract and helps you to move your bowels. It also transports really important nutrients around your body. Some fluids can, unfortunately, irritate your bladder and your bowels, and these can include tea, coffee, fizzy drinks, dark blackcurrant cordials, hot chocolate and alcohol. So if you want to refrain from those sort of drinks or drink decaffeinated products, that will really help. Don't just go to the toilet just in case. Try and regulate visiting the toilet every 2 to 3 hours. It's really important that you don't rush your wheeze or voids, and make sure that you're sitting comfortably. Preferably sit down wheeze are better than stand up wheeze, as these help to reduce and relax the pelvic floor muscles so you empty your bladder properly. Sometimes we find symptoms of overactive bladder are related to constipation. It's really important that patients realise the symptoms of constipation, which can be hard, firm stools, straining when opening bowels, and passing type 1 to 3 stool, which is usually dark in colour, very lumpy and bumpy, and also can be very gritty. So the healthier the stool is healthy, light brown, type 4 stool, smooth like a sausage and easy to pass. It's what we call in the team our gold standard poo. It's really important to add fibre to your diet and the correct amount of fluids to make sure that your bowel is healthy. Lots of people feel that they have to eat lots of fruit and vegetables for fibre. However, there's lots of different foods that contain fibre, such as digestive biscuits, seeded fruits that have got their own skins on, which are really suitable. But if you want any further information, we have a fibre sheet that we can send to you. It's important that if you increase your fibre, you're drinking enough, as just fibre in your diet without enough fluids can make the stools even more harder. Always remember that if you have any blood or dark urine, to report it to a professional, whether this being your GP or your specialist nurse in the Bladder and Bowel service. If you have any change in bowel habits, where you have loose stool one day and constipated stool the next, also this can be related to weight loss and pain when you have your bowels open, please seek medical attention as soon as possible. Early intervention into bladder and bowel cancers have a really good success rate, so please seek help. Also, if you're having lots of urine infections and feel like you're not emptying your bladder properly, please contact us at the service or your GP for further investigations. It's really important, if you are prescribed containment products, which we call pads, that you store these in the appropriate place in your home. Please don't store them in bathrooms or environments that are that have access to moisture, and also that the environment's too hot. This will make the pads absorb the moisture of the environment and stop them from working properly when you apply them to your body. It's really important that we look after our skin, and a lot of patients that have got urinary and fecal incontinence are more at risk of developing moisture lesions and pressure ulcers. Always remember to cleanse your skin with warm water, not soap, and apply an appropriate barrier cream. Please be aware that barrier creams that contain oil aren't suitable, as this stops the urine or faeces being absorbed into the product. So always ask a member of your specialist team or your GP for the appropriate barrier cream to apply. This usually can be applied twice per day to the affected area around the buttocks, groins, making sure that they don't get red and excoriated. On the CCICP Community Bladder and Bowel website, you will find links to Tenor products. These links contain information and education on how to apply the products correctly to yourselves. These include all-in-one products, pull-on products, figure of 8 with fixation pants. And remember, you can always give us a call at the service if you need any further support. Our number is 01270 826 360, or you can email us at ccicp.communitybladderbowelservice@mcht.nhs.uk. Thank you.